Light change. Light change. இது ஃப்ரண்ட் இது வந்து பேக் ஃப்ரண்ட் வருது ஆர்டிஸ்ட் லைட் அடுத்த இது வந்து பின்னாடி வருது.
You all know. So when we talk about harm done to the body, right? Yeah, harm done. Yeah, harm done can be divided into hurt and injury. So section 319 of IPC and section 114 of BNS defines hurt. Causing bodily pain, disease or infirmity is called hurt. Causing bodily pain, disease or infirmity is called hurt. Is it conclusive? Is it? Does it convey every meaning? Is the sentence full? But this is a legal definition. We cannot change anything. So if you want to change anything, you put in bracket harm done to pain, disease or infirmity with or without bodily injury. With or without bodily injury. Can you see disease? Can you see pain? Can you see infirmity? So these looks like very incomplete, right? All these things we cannot see. Only the patient can complain, right? So he can make fake complaints also, right? So causing bodily pain, disease or infirmity with or without external bodily injury. Bodily injury is called hurt. In the simplest form, it is causing bodily pain, disease or infirmity. At the same time, it can cause grievous hurt and fatal hurt also. So this definition does not include grievous hurt and fatal hurt. So hurt is a harm done to a body. In the simplest definition, hurt is a harm done to the body. Whereas injury is a harm done to the body, mind, reputation or property. Hurt is only 1/4 of injury, right? Hurt is a harm done to the body, whereas injury is a harm done to the body, mind, reputation or property. Classification of injuries, bodily injuries. Classification of bodily injuries. So we can say she's a tall girl, short girl, Salem girl, Madras girl, Hindi speaking girl, Tamil speaking girl, right? Brilliant girl, moderate girl, right? So there are so many classifications. Similarly, injuries can also be classified in many ways, like based on the incidence of death, like antemortem injury and postmortem injury. Whatever injury is sustained before death is antemortem injury. Whatever lesions produced after death is postmortem injury. Can a person make a injury after death? So this means postmortem injury means foul play, right? For gain or for implicating somebody else, one may produce injury after death and say this is antemortem injury. So if you are well versed with the injuries, character of the injuries caused before death and after death, you can make the difference between. Can Kavi Bharati say a difference between antemortem injury and postmortem injury? How can you identify? Are you going to see it? You are not an eyewitness. Yes, why? 1 minute without violence too. You can see the vital signs, right? If the injury is sustained before death, you can see the vital signs, rubor, tumor, dollar, and other inflammatory changes, reparative changes, right? So antemortem injury will show all these things, whereas postmortem injury will not show all these things. So based on the legality, you can say legal injury and illegal injury. The surgeon puts the knife, incises, removes some part of the body, maybe disease, right? So this is a legal injury. Whereas assault, injury is caused by assault or illegal injury. Based on the source of infliction, an injury can be mechanical injury, chemical injury, thermal injury, electrical injury, radiation injury, and firearm and bomb blast injury. And based upon the type of weapon, if an injury is caused by short cutting weapon and the injury is caused by blunt weapons. And based on the motive of infliction, you can classify injuries as suicidal injuries, homicidal injuries, accidental injuries, accidents caused by, so injuries caused by accidents. When you say injuries caused by accidents, it is almost always accidental. But some people may have foul play. Some people may try to commit murder using a heavy vehicle. Right? So we cannot say ignore it as accident. So accidental injuries can be caused by accidents or can be done by foul play. Right? And so suicidal injuries, homicidal injuries. Homicidal injuries may be due to rash and negligent act, as in road traffic accidents. Right? Or any injury caused by rash and negligent act. Right? Then culpable homicide not amounting to murder. You are hitting a person, he dies actually. Or you are assaulting a person, which causes amputation of a finger or leg. So, can we say this is murder, even if the person dies? You are giving a punch over the abdomen of the person. He collapses due to what happened? Reflex. Planting, reflex. Right? He dies. Did you have an intention to kill the person? No. So these are injuries, but they are culpable. They are punishable. Punishable injuries not amounting to murder. So based on the motive of the infliction, suicidal injuries, homicidal injuries can be due to rash and negligent act, culpable homicide not amounting to murder, and culpable homicide amounting to murder. A culpable homicide when becomes caused with a motive, plan, and done without any excuse. Whatever happened to me, it's okay, it's welcome. He caused this injury to me, he caused this harm to me, so I have to revenge. I have to kill him. What is it? They will kill me. They will give me a life imprisonment. I am ready to take. Right? So, culpable homicide is done with a motive, done with a plan, and done without any excuse. It becomes a murder. Then, accidental injuries, injuries due to accidents, and self-inflicted and fabricated injuries. These are classification based on the source motive. Then based on severity, we classify simple injury, grievous injuries, and grievous fatal injuries. Simple injuries are simple cuts. Grievous injuries are grievous cuts. Fatal injuries are fatal cuts. But hurt is caused to the body alone. Here, the hurt is done to the body alone. So it is simple injury, simple bodily injury, grievous bodily injury, and fatal bodily injury. As the definition said we already, as the definition we saw already, causing pain, infirmity, or disease is health. So that is simple. That may fit for the simple hurt. And any hurt which can heal within 20 days without any sequelae is the simplest definition for simple hurt. Any injury done to the body which can heal within 20 days without any sequelae is called simple hurt. Fatal hurt, any hurt which can cause death without even producing any external injury, making him to breathe cyanide, nitrous oxide, hydrogen sulfide, or just injecting insulin via vein, intravenous injection of insulin can cause death without causing much external injury. So even though they don't cause much external injury, they are fatal injuries, maybe biochemical, right? So like that, it's also a fatal injury. So any injury that can cause death, whether it is simple, grievous, or anything, it is a fatal injury. Any injury which can cause death is a fatal injury. Now we know what is simple injury. Simple injury, Marangisara, is any injury that any injury which heals within 20 days without any sequelae. Right? Fatal injury is any injury which can cause death. In between, you have grievous hurt. You have emasculation. You have permanent disfiguration of head and head, unbar or face. Can be head or face. So permanent disfiguration of head bar, unbar or face. Permanent privation of sight of either eye. Either eye means any one eye, not necessarily both. Permanent privation of hearing of either ear. Permanent privation of any joint or limb. And permanent privation of power of any member of joint. Removing my right arm is equal to making my right arm unuseful. Right? So making powerless of my limb amounts to amputation. Right? Permanent privation of member or joint, permanent privation of power of any fracture of any long bone, and fracture of any tooth. And finally, the 8th class comes, any injury that can cause death. Death is a grievous injury. It can be a gas. It can be an injection. Right? It may be an assault. So any injury which can cause death is grievous injury. By this 8, all grievous fatal injuries are grievous injuries. But for this 8, none of the grievous hurts are fatal injuries. Right? Privation of sight of eye, privation of hearing, loss of causing emasculation. Nothing is fatal. Disfigurement of face. Nothing is fatal. But for 8, any injury that can cause death is a grievous injury. But not all grievous injuries are fatal injuries. And any injury which makes the person unable to perform his normal pursuits for a period more than 20 days. So if you say he has to be bedridden for 19 days, it is not grievous. If you say he has to stay for 2 more days, it becomes grievous. So this is where doctor can do mischief. If the offender gives you money, you will send him by 19 days. Right? If the culprit gives you money, keep me for few more days, then it becomes grievous. Right? So we have seen all the grievous that emasculation, permanent disfiguration of head and face, permanent privation of sight of either eye, permanent privation of hearing of either ear, privation of any member of joint, destruction of permanent impairment of power of any member of joint, fracture dislocation of any long bone or tooth, and any heart which endangers life is grievous injury. Because of that, all fatal injuries are grievous injuries. Except for this, none of the grievous injuries are fatal, right? And here we have to know about vitriol age. What is vitriol age? Udaykaran, is Udaykaran and he is in some other batch. Udaykaran, some other batch. I asked him what's your name, he said Udaykaran. That's why I remember. I forgot your name. What's your name? Just what the name. Yes. So vitriol is throwing off any corrosive substance, especially acid, especially sulfuric acid. What's the other name for sulfuric acid? Oil of vitriol. So it's most powerful corrosive acid. So the throwing of corrosive acid, especially sulfuric acid, over the face, may disfigure the face, right? So mapla correct mata. Yes or no? Okay. And not only that, it can cause permanent disfiguration of the face. Can it cause ulceration of the eye? Can cause panophthalmitis. Can cause involve every layer of the eye, cornea, conjunctiva, iris, retina, everything. So it can cause panophthalmitis, which can easily spread to cavernous sinus and meninges and to the brain, causing encephalitis. And all these things are definitely bad, can be fatal. So all these things can be fatal, right? So visual is when the acid can cause disfigurement of face, can cause blindness of eye, and it can cause death. So it is a grievous injury, right? Then classification of mechanical injuries. So we have seen so many classifications. This is about mechanical injuries, classification of mechanical injuries. If you are asked to classify mechanical injury, you have to say this. If you are to classify injuries, you have to remove right about all other things, especially mechanical, chemical, physical, electrical, firearm and bomb blast injuries. You have to. So these two are very. So mechanical injuries can be abrasion, which can be scratch abrasion, puncture abrasion. Can you tell me an example of pressure abrasion? Hanging, right? Hanging is causing abrasion caused by pressure. Then impact abrasion you can do to heating of a grill, produce a grill pattern of a car over the body inside impact abrasion. And tram track appearance of contusions. You are hitting a person with an object. The edge will produce a tram track appearance, right? So let's start the due to pressure abrasion. Pattern abrasion, we have seen grill pattern, rope pattern, tram track appearance are all pattern abrasion. The nail pattern, right? Then you have confused abrasion, which is associated with force. There is application of force as well as pressure. Whereas other things are grace abrasion. Is due to dragging of a person over a rough surface. Especially we can see a body pulling over a rough surface in road traffic accidents or accidents. Then you have contusions, lacerations, cut or incise the wounds, sharp wounds, snap wounds, penetrating wounds, fractures and dislocations. Means lacerations can be inside lacerating, split laceration, stretch lacerating, and avulsive lacerating. Then this is also a form of injury in the body, fracture of skull. Fissure fracture or hairline fracture, compressive fracture, cut fracture, which can be linear, gutter, or glancing injuries. Linear, gutter, or glancing injuries. Then comminuted fracture, diastatic fracture, which involves the suture area. Perforating fracture as caused by crowbar or gunshot. Bone fracture is due to inadequate calcification of skull bones. So long bones, green stem fracture, which you only bend without any discontinuity of the structure. Similarly, bone fracture is indenting of the part of skull bone without any fracture. Then you have ring fracture, which separates the anterior tuber of the skull from the posterior tuber around the crater foramen magnum. Then battle fracture, which includes anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. And signature feature, which involves the compressive fracture, which coming, cut fracture, and perforating fracture. These fractures successfully weapon used. So they are called signature fracture. Then fractures are long bones, simple fracture, average fracture, thicker fracture, clean chip fracture, partial fracture, complete fracture. It is complete full thickness fracture. If it is a full thickness fracture, it may be simple fracture, compound fracture, or comminuted fracture. Compound fracture means the fragments of the skin that comes out, so that infection can be easy, right? Comminuted means into multiple fragments. In unclassified injuries, namely intracerebral injuries, hoop injury, and counter injury. Hoop injury is one where lesions are to be immediately below the area of contact of the soil. If it hit with the log over the right side of it, the immediate underlying meninges and brain then gets confused or even lacerated. That is known as non-hoop injury. Under-hoop injury is one where the lesion is produced diagonally opposite to the opposite part of the side of the eye. Don't say opposite part. It is diagonally opposite, right? So left side of right, you can have it over the right side of the right side of right, you have over the left side of you have the right side, you have on the left side. The hip is over the right side, you have lesions over the left side. So that's how hoop injuries, counter-hoop injuries are used. Another way of doing this is shear strain. Shear strain is one where there is change in shape without changing volume. This is possible when there is a rotational force. Different layers of the brain moving in different directions. So there will be injury to the axons. Right? So that's why it will be used for the CT scan to detect. The CT scan detects various levels of brain. This also due to movement around the parts of the brain in various different directions. So then, because it will coverage it's possible. Subdural or subarachnoid coverage can be possible. Ventricular coverage can be possible. Loss of consciousness can be possible. So this is especially if you know shear strain. So when there is a loss of consciousness due to injury, he may automatically recover. What is this phenomenon known as? Anybody? Anybody? Is that? Under here or not? What is solution related to this thing? So, loose interval you come across two places. Loose interval you come across in two places. One is related to other is related to the psychotic illness. In psychotic illness, loose interval is the same period between two periods of insanity. Can a person undergo contract in this loose interval? Can a person involve himself in a contract? Can be a party of contract during this period? Yes. During instant period, he cannot. People say, or absolutely. So, contract. So, person is liable for his body, loose interval in case of psychotic illness. But here, loose interval is conscious period between two periods of unconsciousness. The same period between two periods of insane period. Here, conscious period between two unconscious period. So when there is an accident in a positive corona, sustains brain injury, automatically he becomes unconscious due to pain shock. Due to pain shock. Right? Then after some time, our mind is going to spray water. Sprinkles water. Holy water or ordinary water? Holy water. So he sprinkles water and the person becomes conscious. Takes consciousness. Right now, instead of doing something good, we give a blow on the heart. Yes? So, unconsciousness, consciousness, then again after some time becomes unconscious. During this conscious period, he thinks permission is the boy to hit him. So, he gives him nicely back. But this is due to automatism. This is due to automatism. Primary episode of unconscious is due to shock. Then he regains. Another second mode of unconscious is due to family. It is the individual memory. And he undergoes unconsciousness. In between, the brief period where he becomes conscious shows automatism. This period, this loose interval, is not liable for his acts. Right? Then psychotic, he is liable for his act. Yet he is not liable for his act. This is our loose interval. Then cervical vertebra. Cervical vertebra can cause sudden death. Cervical fracture of vertebra can cause sudden death. And especially and this cervical fracture of vertebra is known as pit flap injury. Pit flap injury. This can be infantile pit flap injury. And this is the part of water baby syndrome. Water baby syndrome. Infantile whiplash injury and adult whiplash injury. Adult whiplash injury is due to sudden hyperextension. Is going behind a Dipper line, you know, the back side is it goes in a pipe, goes below the lorry, and you skate, hits over the posterior part of the dipper line. It has a sudden hit. Or he is sitting in the front row, dashes against the dashboard, hits against the dashboard, they get hyperextension. The other whiplash is due to hyperextension and the some books may have hyperflexibility and followed by hyperextensions. Hyperextension. Can you hyperflex just from the lab? Can you hyperflexible it? It is limited. The flexion movement of the head is limited. So there can be no hyperflexion. So this other whiplash is only due to hyperextension. But as part of Dr. syndrome, get hold of the hand, right? Or you lift the child, shape, so that there is chance for hyperflexion, right? This infantile whiplash syndrome can be due to hyperflexion followed by hyperextension. Whereas other whiplash syndrome is only due to hyperextension. Causing fracture distortion to the cervical vertebra, in the upper cervical, or in the lower cervical C5, C6, etc. And can cause another. Yes. Here we see the pattern, fracture appearance. You know, points left or double. So this is pattern confused appearance. Grace appearance. Grace appearance. Not to drag it. Right? Our see that way. That is aberration. Our see last way. Again, grace appearance. Start injury with the knife over the outer aspect of the cut injury. Right? Start. Sharp injury. We can see that fracture of the scapula. Target abrasion, you can see. Pattern abrasion due to negativity. So, oblique is hardly under the hip. First injury. Not a good fracture. The colleagues fracture into multiple pieces. Let's see that some kind of other line has bounced out. And fracture of the facial bones. The mandible and maxilla also. Right? So involving the maxilla, the mandible. Start injury. You can see the humiliating column intestine, right? Start injury. One fracture of skull. Comminuted fracture. Actinic fracture involving the sutural line. Comminuted fracture. Again, comminuted fracture. Gutter fracture. You have produced a gutter. And 630 happen, right? Can be a large something, right? Penetrating fracture by bullet. Arise. This is writing burn. Again, burn. Fracture base of skull involving R3, so
Thank you for giving your valuable interaction. Bye. Now, I invite to create Dr. Bhaskar sir to present the topic on medical road traffic accident. Welcome, sir.
Then I'm going to talk about medical legal aspects of negligence. Right? So, as a forensic surgeon, if you have to become a forensic surgeon, you may have to take which is certificate, whom you examine, then give us salary. Right? If you are a casualty medical officer, police will bring then a culprit who was assaulted by an accused. You may have to examine him and give himself. That's one part. Yeah. Well, before you, especially given medical officers, or ascertaining she was security or something, right? And children may be asked for the forensic surgeon to assess the age, whether to be in juvenile home or not, or the classic treatment and that normal adult, right? And finally, you will have to do a postmortem examination if necessary. If the person, the culprit is dead, you may have to do a postmortem investigation and give back the certificate. Why did you do this postmortem certificate and things and about the things? To help the victim or the victim's family. Officer to establish the offense before the court of law and to help the judiciary to come to a conclusion and to the proper punishment and to establish the justice. So you are doing this job to establish justice. So the injuries will depend upon the type of weapon. Thin blade, short cutting edge, like scalpel blade, shaving blade, razor blade, they can all produce linear scratches or superficial cut injuries. Even the superficial cut injuries can be kind of rupture of the severity of the sugar range, etc., which may end in fatal, right? So it's just because this is thin blade handle very easily. They are nevertheless not necessarily they should be harmless, they can be harmful too. Right? Next you have so cutting blade with the sharp edge, not rather blade, scalpel knife, kitchen knife, which can be single edged or double edged. Right? They can produce engineering the plate and the baby. With the help of which you can know the direction of the engineering. The relative position of the argument is the culprit. And whether the culprit is a right-handed person or a left-handed person. Right? So all these things you can come to a conclusion with the by knowing the weapon. Then heavy cutting and sharp cutting knife weapons. Heavy and sharp cutting weapons like Kodawal, Arwal, sickle, and vision ball. So this Kodawal, vision ball, Arwal, etc. are curved weapons. So when we produce a cutting heavy as well as by cutting, we will have clear of start engine. So just because there is a cut in front and start again, you should not take it granted that two weapons are used and transferring two weapons right? So this instrument can misguide you. If you know about the nature of the weapon and you are seeing the weapon, that's why whenever we give a certificate, we will ask the investigating officer to show the weapon. Right? So after seeing the weapon, we can conclude that it's not a single person with a single weapon. Right? And many times there may be two culprits producing different types of injuries, cut injury, stab injury, penetrating injury, laceration, etc. etc. So we can conclude that there are more than one accused and there are usage of more than one weapon. Then having any cutting dangerous weapons like butcher knife, axe, sword, etc., which can produce stab injury, which can produce sharp injuries with the fractures of the skull or long bones or digits, causing severe issue. Severe alone in that becomes a grievous injury. Fracture alone is there, storm becomes a grievous injury. If there is arbitrary and the patient survives, it becomes a grievous injury. But the personal privacy becomes a vital. Right? So these guidelines, the punishment will also depend upon what type of weapon is used. Injury cutting, injuries are caused by light weapons. Injuries caused by heavy weapons. Injuries are caused by heavy and dangerous weapons. All is only causing injury by heavy and dangerous weapons. For everything, the punishment will gradually increase. Right? So you are taking that judiciary in that manner. Right? Then final objects like dagger, bullet, and crowbar. They can not only produce stab injuries, they can not only cause penetrating injuries, it can also cause perforating injuries. Perforating injuries means you have an entry wound and then exit wound. Bullets can cause entry wound as well as exit wound. Crowbar can cause an entry wound as well as exit wound. And not necessarily they will be very dangerous and life-threatening and may cause death. Then you have blunt weapons, wooden rod, hammer, iron rod, stone, ball, etc. And it's just the body that. So these all cause both bodily conditions. Sometimes abrasion with the condition, sometimes condition with fracture of underlying bones. Especially it's if you ask the person commits a war, But instead, there may be some, right? Or there may be some level of like, say, the type of injuries. Based on the weapons we saw already, the lesions will be abrasion. It can be straight, scratch, graze, cut, or pattern, or contusions. The measurement of which is very essential. The lesions can be severity of the injury depends upon the measurement, and in the air be contingent by the color, etc. And we have to see whether there is a single injury or multiple injuries, whether it is pattern or irregular. The laceration, there are split lacerations, inside blood laceration, and lateral. Cut injuries, inside injuries, helps us to estimate the direction, relative position of the accused and culprit, whether right or left handed individual, etc. Stab injuries and deaths by dagger or sword. Sharp injury surface, the nature of weapon, and there may be fracture of the bones. The sharp injury also gives an idea of the relative position and the direction of the bones. Then you are penetrating and perforating injury started by travel. Its weapons like bullet, crowbar. Then time of origin of injury, that is age distribution of the injury. You are doing a postmortem injury and gives a certificate that the person has shown fresh antemortem injuries, right? Antemortem injuries, that is within 24 hours. The accused proves that he was in Bombay at the time. He may be in Madras, but he may produce false evidence that he was in Bombay. It's not as alibi. If it is proved alibi, you will be punishable on that. Apart from normal offense, you will also be punished for causing alibi, causing perjury, giving false statement, willfully giving false evidence under oath in the witness chamber. Right? What is perjury? Willfully causing false evidence, giving false evidence under oath in the witness box with your motive. There are four components of perjury. Right? So that's why the age is important. Right? So within 24 hours, the injury right, it's a right. Not right. So within some other things coming by it. So within 24 hours, you may have brain injury with brain scan. And within 2 to 3 days, there will be creating brown stab. By 4 to 7 days, everything can grows under the scab. And after 7 days, the scab falls, stop leaving normal skin. So abrasion keeps without any skin bleed. After 7 or 8 days, there may be no evidence of any injury sustained. Aging of bruising includes, aging of bruising or condition includes, first will be breakup, up to 3 days circulating blood, because of the cyanotic change of the RBCs. And after 4 to 5 days, it will be brown blood due to lightness of RBCs circulating between hemocytic liquids. After by 6 days, it will be green due to hemoglobin. And 7 to 12 days, it will be yellow color due to urine bilirubin. So this is how you can achieve the contributions. So this is how you can give how long back the person sustained injuries. And last one is fresh up to 20 colors, break in color, margins show inflammatory state, that is when you chicken, and 2 to 3 days, that is improving of epidermal cells, infiltrate of acute inflammatory cells, and proliferation of new blood vessels. So that injury spot appears pinkish in color, so it is called as pink granulation tissue. After 4 or 5 days, there will be chronic inflammatory inflammation. Blood vessels will be obliterated. There will be formation of fibrous tissue. When there is a formation of fibrous tissue, the field will look whitish. So this is pale granulation. And after that, by about 1 to 2 weeks, the region will be replaced by scar tissue. And if there is a scar tissue, that means the person has sustained injury 2 weeks. And now you can estimate the injuries, and there is an investigating officer as to when the injury was caused, by what type of weapon it was caused. Right? And by saying that it is the simple so natural immunity, simple, reverse, abnormal, all these things. And visual age. Also, we saw in the morning. We also saw why it is grievous. It is grievous because it can alter the structure, can cause brightness, can endanger life. Right? So it is grievous injury. Gunshot wounds. The required investigation is simple. Retrieving a bullet. It is eaten within the body. You can get the informed with rings. You can trace the track of the bullet. And to wipe the margins of the gunshot, to wipe the margins of the gunshot injuries and send it for the forensic science laboratory, who will find out the residues, gunpowder, etc. Right? You can also send it for histopathological examination. Then again, regarding sexual offences, section 375 of IPC of BNS, you have to take facts. Preferably a male medical officer, no other care, the male medical officer can do it with the in presence of the attendant, right? Uninterested attendant. If there is any violent act, make a violent thing. You will write in the exam, spread the white paper, ask the victim to stand, go back. Bunch of act will be useful. If you cut and say, that is necessary. Why violent is necessary? Contains nucleus. Nucleus contains DNA. Chromosomes. Chromosomes contain DNA. So this DNA will be able to identify an individual. And this is relative of his relative. So swab has to be taken, have with the molecule, and the person can take photos. If the person is alive, you get the consent. Don't forget to get consent whenever necessary. Because touching the patient without consent is an offense or not? It's an offense. It can be penalized. Right? So if it's alive, you get the consent and take photos or videos. And if they do a postmortem examination, videos and it will be very much helpful for the division. And when giving report of sexual offense, 100 times you may tell, but in the opinion you will write forceful sexual offense. Is it force? Velocity is a velocity mode. It is forcible under compulsion. Force will be using force to budge her. Right? So you give us evidence of sexual assault, forcible sexual assault, or evidence of sexual assault with evidence of multiple injuries over other parts of the local and other parts of the body. So this is where from which the judge will give punishment. So yesterday what has really happened. Based on which only punishment. Don't simply use evidence of sexual assault. Can we with consent? That is not to say that is no consent. Many cases in those days, few years back, sexual offense rape case people prosecuted and accused and the victim will come, although separately, and a few months later they will come to get some which service because on the side. You have habits. It might be only to use itself. Investigating action, we have no other one start, yes. It is like this, right? But now women are very strong, right? They want the accused to be punished by all means, right? So, like that, there is evidence of forceful sexual assault. Don't like forceful. Forceful means velocity. Velocity is not a matter. Forceful. She is overpowered by physical assault or the other means, right? So, forceful sexual assault is evidence of injury in the very the reproductive organ or in the other parts of the. So, this will get that to come to a conclusion and so you can take the charge to document the seminal fluid is there. By writing the examination, seminal fluids can be identified by smearing and through preparing a slide. You can demonstrate biopsy or wet sponge if possible. If biopsy examines sponge are there, you can also do a DNA analysis. Right? So for all these things, swab will be necessary, and you don't forget to take swab whenever you examine a patient of sexual assault. Then sample of blood is required, especially in postmortem examinations. Preservation of sexual organs is routine in postmortem examination. And if thermal injuries, take swab of the involved scene, especially the margin, because they may show inflammatory substances like petrol. Ordinarily, especially the women, the anti-inflammatory substances, corrosion of glands. If petrol is free, do we use petrol in the kitchen? So you see the idea of motivation. In Chennai, we people complain. You watch him successfully, not God. The history given was, he was having a mosquito coil on his bed. With a mosquito coil, you extensive fire, birds, bed sheet, pillow, body, etc. So, the first case was done when I was on the it's another medical accident. He gave it as burns. The next case came, I was suspicious because it showed evidence of postmortem burns. That was not rightly. Yeah. I called the investigating officer and paid up this. So it was not the pipe is at least 2 feet below the car. How can I fire it? And I said, it looks like it was not a box. Subsequently, one case can be that stages. Okay, okay. Okay, here this, you let it pending. And activate another partner. So repetition. Once you have found suspect something, and it is confirmed by another theory. So sequence approach the case like these are all post-mortem. So if you know that you differentiate between anti-mortem works and post-mortem works, it will be a very good investigating of division. And we take bits from the margins from the birth area to see any right of reaction. Sending parts from the logical example. It will be a firm evidence for you to prove that it is a case of anti-mortem or post-mortem. Post-mortem works, there will be no vital. In electrical insurance, the pattern of the copper wire or the plug between the dead and then the connection of the material, metallic material from the electrodes to the body to take the body temperature in the chemical analysis, right? W is done by team of doctors, don't forget, done by team of doctors, and it should be done by another video, another video. And what are the states, blood state or other state, collected for forensic science lab located in forensic science lab is located. In front of lighthouse. Here we have two BGP office. BGP office, forensic science lab. In front, beach road. On the beach side, you have the lighthouse. Right? And whenever you are examining a patient, don't forget to examine the bloods. There is a quarrel that we must not. There is a cut injury over the body, the blood will be also critical. There is a critical injury, gunshot injury, the cloth will be burned. So you are collect all those things and send for clinical analysis to the forensic. And time of admission and time of death, get it from the hospital records. In Rayagada, when I entered as a forensic surgeon, the cases brought back to this directly marched. Police will bring the patient for doing a postmortem exam. I insisted that it should be made for each and every case, even if it is brought back. Right? So, the investigating officer mentions injuries. The margin, the calculating doctor can be injuries. He is admitted in the ward, the ward doctor also enters injury. Comes for postmortem examination, and we will also discriminate. All these things should go inside. If anyone being here, that means he is doing it. How it may. That means he is negligent. Criminal accident. Right? And for interesting case, the case not brought in. Because it was made. The casualty medical officer was at its use. And the one boy. So, brought it and a partner. So, brought it us. Okay. Pulse going, no BP. ECG plan, no reflexes. Correct? No pulse, no BP, no reflexes, including cardiac reflex. No respiration, no heart sound. That is the patient thinks. Patient is all awake. Okay. So the medical officer, patient brought in, sent to mortuary. And that day, the doctor had patient from the police. The boy on the table. The fellow was admitted in Apollo, not Then he has donated this hernia, he has donated this heart, he has donated this liver and kidney. And the medical officer has done ECG, reflexes, pulse, BP, all. Sir, what's your record? Your record is all these things. If I feel there is no liver, no kidney, the patient is willing to think what I have told. And he is made this something now. Anyway, he requested to apologize. He also requested my excuses. What I asked him to he would. Yeah, right? Now, as per the review, no, there was no cardia. Second, no, pulse BP not recorded. Because it is already there. Recently not done. Body symptomatic, then I do the postmortem examination. So, for every postmortem, you see that, yeah, it is admitted, see that cause of this, notified by the ward medical office. Right? All those things you have to be careful. So, admission and time of death, time of admission, time of death, clinical diagnosis, last subject, all the correct, the person is admitted in the hospital before death, right? And finally, what I told you the importance of explaining the injuries, explaining the injuries in sexual offenses, explaining the type of weapon used, explaining the injuries obtained, whether single edge, double edge, whether stable, all getting the directive and taking question of the accused and victims, whether they are accused this, right hand person is there. Even in suicide, the culture of increase, the right hand person would increase over the outside of the neck. The left hand person, so all these things come into your mind, right? And time of sustaining injury. Correct, the person died. The injuries are fracture and immortal in nature. The injuries are this many hours old, many days old. And whether caused by a single weapon, whether caused by a single person, type of weapon used, whether it is single weapon, by a single edge weapon, single weapon, heavy weapon, dangerous weapon, gunshot injury, bullet injury, etc. 20 weapons. Whether simple grievous are necessarily fatal. Then you write a class and you write additional findings in the class that you cannot find. So you are sending the log of right? So all this additional findings is very also which. Then finally, to the day, place of examination, sign, your sign should always cannot continue. Without name, sign is a base. Sign is not very formation without the name. And of course, it is supported by the seal. Right? This is how you can do the injury certificate. And these are the medical applications of injury. Thank you.
Session, sir. Now, I would like to call upon Dr. Nawaz Ahmed, sir, to felicitate Dr. Pastor, sir.